So I'm going to turn to the final session of our annual meeting. It's the President's Forum, which will be led and moderated by Victor Dzau, the President of the National Academy of Medicine. So over to you, Victor.
Thank you, Sue, and the Planning Committee for really an outstanding program throughout the day. And of course, thank Secretary Becerra for joining us for those closing remarks. So as you can hear, today we've been talking about pandemics, climate change, and the many, many health crises that we see ourselves facing. This last session, as a transition to President's Forum, is focused on climate change, human health, and equity. Now, we've been discussing this morning. I also said in some detail this morning in my president's remarks about the grand challenge that we're launching. I will say a few more words about this, but let me just simply say that how honored we are to have Gina McCarthy, Honorable, the White House National Climate Advisor, to kick off this exciting forum. Gina McCarthy is the first National Climate Advisor, the President's Chief Advisor on Domestic Climate Policy. It leads the White House Office of Domestic Climate Policy, focused on mobilizing a whole-of-government approach to tackling the climate crisis, creating good-paying union jobs, and securing environmental justice. Previously, she served as the 13th Administrator of the Environmental Protection Agency, and then as President and CEO of the Natural Resource Defense Council. As one of the nation's most trusted and accomplished voices on climate issues, she's been at the forefront of environmental and public health progress in a variety of leading roles for over 3 decades. So throughout her career, she has advised 5 administrations on environmental matters. She served as Commissioner of the Connecticut Department of Environmental Protection prior to being appointed by President Obama to head the EPA Air Office. And of course, as EPA Administrator, she pursued innovative global collaborations with United Nations, the WHO, and on global efforts to address pollution. Importantly, I have just found her so accessible, so supportive, and I think everybody would say, wow, she gets it. I mean, she's worked in all these areas, but I think she also focuses greatly on human impact. And that's why we want her to speak to us today. So please join me in welcoming Gina McCarthy.
Well, first of all, thank you, Dr. Dzau. It's wonderful to see you again. And I'm really excited to have a chance to be with all of you at the National Academy of Medicine. You know, I can tell from all of your agenda that you're really tackling some of the most pressing health challenges that our communities and frankly our world is changing. And I'm so excited that Secretary Becerra helped to spearhead a lot of work that's going on at HHS with John Balbus and all of his crew, and how exciting it is to see that President Biden's National Climate Task Force is really integrating climate into the work of all of our efforts across the administration. It's no longer about what EPA does or DOI does to protect our planet. It's about what all of us do to protect our common wealth and our health. So it's really important that we have all of you engaged in this issue. You know, the climate crisis, as we all know, is a public health crisis because the planet just doesn't care if it becomes uninhabitable. We care if it becomes uninhabitable. And so thank you for the opportunity to just say a few words. And I want to start by saying that President Biden has understood for quite some time that the issue of climate change is a code red for humanity. It is about protecting our public health right here and right now. And this happens to be the decisive decade for climate action. You know, we saw last summer and this fall that the stakes are incredibly high. People across the West and the Midwest, they're breathing in dangerous wildfire smoke that shoots all the way across the country. And so many people have been exposed to scorching heat waves. Communities along our Gulf Coast, and look at the Eastern Seaboard, they're getting hit hard by hurricanes, losing powers in their homes and even in their hospitals. You know, homes were getting flooded, lives were lost, and contaminated water was making people sick. And it's not just extreme weather events that we're having to deal with these days, because climate change is actually jeopardizing our food and our water supplies and our supplies of products all across the country. And it's bringing disease-carrying insects into new areas, and it's taking a toll, as we all know, on our mental health. So the challenges we face are enormous, but working at the intersect of climate and health is also an incredibly important opportunity that we need to grab. Because as we make progress on climate solutions, we're also going to alleviate long-standing health problems. Just think about it. By moving to 100% clean energy, we're going to improve our air quality immensely, especially for the fence line communities that have been most burdened by pollution. And by advancing to electric vehicles and cleaning up our transportation sector, we will be able to prevent tens of thousands of asthma attacks every single year. And through building electrification and energy efficiency, we're going to create healthier living environments and improve our indoor air quality. What is wrong with this new picture? Everything is in fact right. You know, we're working right now with Congress to deliver on those climate and health benefits. For example, the bipartisan infrastructure deal would replace old diesel buses with clean zero emissions. We're talking about plugging abandoned oil and gas wells that are currently spewing methane and leaking toxic substances. And the Build Back Better agenda would create a civilian climate corps, which is really exciting because it's going to put a new generation of Americans to work, conserving our land and waters, improving access to green spaces, and making our communities more resilient. So as we seize these opportunities and many more, we're going to be advancing improvements and benefits for people's health all across the country, and in fact the world, if we can manage it when we get to COP in a few weeks. And we're going to also be making sure that at the same time, we are focused on advancing environmental justice for all those communities that have been most burdened by pollution, as well as racial and economic inequalities. It's time for them not just to get their fair share, but get most of the share of the benefits that are coming along. You know, we're implementing a Justice 40 initiative to ensure that disadvantaged communities receive at least 40% of the overall benefits from federal investments. And we're paying attention to disparities in climate impacts because we know that the impacts fall harder on communities of color and low-income households. You know, that's why Secretary Becerra at HHS established his new Office of Climate Change and Health Equity. And I'm enormously proud of the work that he's doing because we need to better understand those disparities if we expect to be able to address them. We need to build back with resilience. We need to reduce our emissions, even from the healthcare sector itself, which I know you are fully committed to doing, and I am so proud of your work. So I really want to thank you all for everything you're doing. We're working hard on heat. We're working hard on resiliency. We're working hard to make sure that we're protecting our HHS facilities, getting grant money out there, working with CDC and NIH, because this is an all hands on deck moment. This is the decisive decade. We either move now or we don't make it happen for the people that we care about. So let's get excited about this. Let's work together. Let's demand change the way we need it. Thanks so much.
Well, thank you. What an energizing, inspirational talk. Just want to give you a clap. I mean,
thank you.
You know, there's hundreds of people.
To you guys.
Well, thank you. There's hundreds of people out there clapping that you can't see, but we are so energized. But you're so right. We are committed. The reason that we want you to speak to us, and as Secretary Becerra and earlier Eric Lander, is to work along with you to also to tell you how committed we are to this. As you know, we want to do our share. This is the biomedical health community. We know that we should be sounding alarm on the public health aspect and human aspect and equity aspect of things. We also know that as a trusted advisor, we should be, in fact, telling the public about the public health crisis that it is. And we need to communicate this. And we also have a duty to advocate for health to be a center of climate planning and policy. And finally, as you pointed out, we should hold ourselves accountable because the U.S. health sector emits 8.5% of all of greenhouse emission in the U.S. And that's a huge number. And what we're promising to do, as you know, as we have launched this Action Collaborative along with Dr. Rachel Levine, is to say we bring together the public and private sectors. And we're going to start measuring and start setting goals to work together along with you and the administration to reach that target that we all want to. So thank you.
Thank you, Doctor. It was great to be here with you. I applaud everything you're doing.
Thank you. Well, it's great to see you.
You too.
Thank you. So that actually is a perfect segue for the President's Forum, because what we want to talk about is what can we do as National Academy of Medicine, but not only NAM, but in fact, how to mobilize the entire community of health, researchers, you name it, in our own community. And we recognize that this is not an easy task, but we want to do this together. So you heard me said earlier this morning, we have several strategic goals. One is to communicate. Second is to systems transformation, that work with systems across and related to health sectors that includes food, nutrition, energy, and others. And third is to activate ourselves to take action. And fourth is to look at research innovation to see how we can transform the system. And so today, I brought the key leaders in the U.S. health sector. It's actually more than that. It's global health sector together to say how can we do this together under the NAM Grand Challenge. I should first say that health sector is diverse, range from hospitals to health systems to healthcare supply chain, infrastructure, biomedical research, and many others. And so we have to bring together these sectors to work together through public and private partnership to reduce carbon emission and ensure resilience and sustainability for the long run. If we do right, as Gina McCarthy and Secretary Becerra said, our efforts will translate not only to reducing carbon emission and minimizing climate change, but also better care and outcomes for our patients, low cost, and greater health equity. So what we have today is 6 esteemed panelists who are leaders in the field, and they share with you how they think about addressing these challenges. So I would like to do the following. I would first like to introduce them, and as I introduce them, I would like them to say a few words about how they see the whole issue. So let me do the following. Let me first introduce them. First, I'd like to introduce Dr. Rachel Levine, the Assistant Secretary for Health, Department of Health and Human Services. As you heard, she also oversees the new office in electric gas and climate change and health equity. Next, we'll hear from Greg Adams, the Chair and CEO of Kaiser Foundation for Health Plan and Hospitals. And they have really achieved amazing stuff. We also hear from Dr. Michelle McMurry-Heath, the President and CEO of BIO, which is Biotechnology Innovation, which has about 1,000 biotechnology companies working together and really interested in this issue. We'll hear from Don Berwick, President Emeritus of the Institute of Healthcare Improvement, and former administrator of CMS. We all know Dawn. We'll hear later from Renee Salas, the UB Fellow in the Center for Climate, Health, and Global Environment at Harvard, and the practicing emergency physician in the Department of Emergency Medicine at the MGH. And we'll hear from Howie Frumkin, Professor Emeritus at University of Washington School of Public Health, and now the Senior Vice President with the Trust of Public Land. Now, here's what I'd like to do. I'd like to ask them all this question, and I will therefore turn in different order to ask people to answer this, my question. So the question is, given your expertise and, and what you work in, how do you see the health sector and related sectors poised to address the climate impacts on health? And what are the key mechanisms of partnership you could yield that could yield a healthier, more equitable, and more resilient society? And second question would be, how's your organization working in this area? So let me turn to Dr. Rachel Levine, the Assistant Secretary of Health. Rachel?
Well, good afternoon. Thank you, Dr. Dzau, for bringing us all together today to talk about this urgent health issue. As we've already heard today, climate change is a threat to our health, and it is clearly a threat to our health right now. And that threat will only increase if we fail to act urgently. One of the newest examples can be found with COVID-19. We have seen how extreme weather stoked by climate change has added to the health threats of COVID-19, shutting down testing and vaccination sites. Now, as has been outlined, President Biden is working across the government and every sector, every agency, and all of government approach to take swift and necessary actions to tackle the climate change emergency. On day one, he fulfilled his commitment to rejoin the Paris Agreement, and he also took executive actions to ensure that we tackle the climate change at home and abroad, creating jobs and strengthening the economy. Now, we are mobilizing on transformation changes that are critical to the 1.5 degrees Celsius limit on the global average temperature rise within reach. We're transforming energy systems, revitalizing the transport sector, and promoting innovation to clean technologies. And this whole of government approach closely aligns with the National Academy of Medicine's work to develop a comprehensive and long-term roadmap for transforming systems such as the healthcare systems. We have a focus on human health, well-being, and equity. All of these collective actions by the administration and the private sector have to work together and have important implications on the social determinants of health, and we have to make sure that no one is left behind. We have to provide urgent support for vulnerable communities, made even more so by the climate crisis. Now, you've heard from Secretary Becerra, supporting environmental justice and climate resilience are priorities of HHS, the priorities of my office. And we are working hard to address climate change and its impact on health, including partnering with you and the National Academy of Medicine and the Action Collaborative on the decarbonization of the U.S. health sector to reduce greenhouse gases in the healthcare sector. So, as has been mentioned, we have launched our new Office of Climate Change and Health Equity. This office will have three main areas of work. The first is to build on the resilience of communities to the health impacts of climate change, especially those communities facing more than their fair share of the climate change burdens. We want to work with all of our regional offices to help tailor solutions to each region. The second is partnering with you and the nation's hospitals and health systems to reduce the greenhouse gas emissions and make them more resilient to the effects of climate change. You just mentioned that the U.S. health sector accounts for roughly 8.5% of U.S. carbon emissions, and that's in the United States. And the global health sector accounts for about 4.5% of global carbon emissions. So this effort is critical. The last area we will do is focus on harnessing the long-term recovery and infrastructure initiatives to combine climate resilience with health equity. It's absolutely critical. So we have joined with 20 other federal agencies in releasing a climate adaptation and resilience plan. HHS's plan provides a roadmap for assuring that all parts of the department address the protection and health of all people, especially those most vulnerable. It also ensures continuity of operations for HHS facilities in the face of extreme weather events and fosters healthy greenhouse gas reduction and resilience efforts. So, this is just beginning. Our work is just beginning, but it is absolutely critical, as has been mentioned by Gina McCarthy extremely enthusiastically. The time is now, and we will not be successful without working together across government, public-private partnerships, across stakeholder groups, across whatever divides us to address this critical issue and ensure that future generations have a place to call home. Thank you.
Well, thank you very much. And as a matter of fact, I want to thank you for your leadership. We've been working with your team. Earlier, we actually heard from John Balbus as well. And of course, you got a great team. We're working closely with them on this collaborative. And I want to thank you for being a co-chair of the collaborative. That's true public-private partnership. The other two co-chairs, as you know, is Sir Andrew Whitty from United and also George Barrett from the former CEO of the Cardinal Health. We just published a paper together in the New England Journal of Medicine, Call to Action. So thank you. We want to work closely with you to make a difference. Let me turn to Greg Adams. Greg, you've done so much already in your institution. Give us your thoughts the next 5 minutes.
Thanks. And I'll try and keep it in 5 minutes. So one, Regina and Dr. Levine have said a lot about where we are and the risks that we've got. So I'm going to not try and repeat that, but we believe strongly, as the nation's largest integrated delivery system, that climate change is the greatest global threat that we face in the 21st century. Our mission is to provide high quality, affordable healthcare and to improve the health of the individual and the members we serve and our communities. And so when we look at this, it is a really, I don't know how to say it, it's a serious kind of oxygen issue for us. And one of the things that I would say is my predecessor, Bernard Tyson, really championed this for the organization. And Bernard grew up understanding healthcare inequities. He grew up understanding issues of housing and issues of pollution, et cetera. And so his commitment was really about not only our living out our mission, but our really being committed to change and to really create health in the communities where we take care of or serve some 66 million people. When we think of this issue, we see it as it's linked to disparities, as others have said. But when we think of health, we believe that every healthcare system, every healthcare organization, every healthcare association is really, owning and being committed to that vision of health. And if we are committed to that vision of health, then we have to understand the connection to of climate change to improving the health of our communities. So as we've looked at our organization, as we look at what we did with COVID and what we saw with COVID, we saw that the people that were most impacted, that had the most harm, were those that were poor, people of color, and the less disadvantaged. The healthcare sector's understanding of its core mission must acknowledge and address the contribution that we're also making to this issue, that we're contributing to the issue. So you mentioned earlier about the 10% of carbon that the healthcare system is committing. So 20 years ago, with Bernard as our leader, we made a commitment that we would get to being neutral in terms of carbon. And it was an amazing experience. I remember I was not the CEO, but I was sitting outside and looking at it. And I remember Bernard championing this. And I remember the struggle our financial people had. I remember the struggles our treasury people had. And one, there was this clear vision that this is where we're going, and this is why we're going there. And two, we brought in, I'll never forget it, an individual as our chief officer of energy. So we brought in someone that was not owning and working this off the side of their desk, but their full-time job was to help our organization look at where we were and how we could get to where we wanted to be over the next 20 years. And that was in 2012. He engaged with finance. They engaged with our treasury department. They looked at our capital process from a long-term perspective, and they were able to show the organization that that vision was really a good business vision. It was good for our business. And so what we were able to do was to really change the organization's thinking so that it understood that if we invested now in energy, if we invested now in eliminating waste, then the outcome of that, and if we invested in sustainable energy, we invested in solar, investing in wind, the outcome of that would be essentially us being better financially 15, 20 years out. I was on the phone yesterday with our National Facilities Services individual who actually led this process, who was able to say today, when we look at our buildings, we look at their energy consumption, we look at how we built them in terms of LEED, platinum and gold buildings, that we're at a place where we are neutral or better in terms of the cost of operating our buildings. So one of the things I want to say is, from a healthcare perspective, we want to do the right thing for our members in our communities. We want them to be healthy. So we've got to step out and lead. But from a business perspective, there's a good business plan here. We can look at this and see that we're able to actually operate our organizations more cost effectively. Quickly, two other things. One, we have to go, that's about going upstream and doing the right thing so that we actually are able to change or at least mitigate the trajectory here. But I think the other thing we have to do is we have to understand kind of the systemic issues in our communities that are contributing to many of the challenges that we have with equity, many of the challenges that we have with people of color and others being impacted differently by climate change and how it connects in terms of health. So we have to also be prepared there. I mean, since 2017, we've had in our Santa Rosa community, two wildfires, one that resulted in our hospital being threatened and being on standby for closure. The other one where we actually had to close the hospital for a substantial period of time, community without hospitals. And we've got to think about how do we build that resiliency in our communities? How do we partner? And how do we really create a way for us to lead our communities through this as we really own what we need to do upstream?
Thank you. Thank you so much. Well, certainly, Greg, you leading the way. But the good news is that our grand challenge now have the participation of many, many hospitals now with their leadership. They got a long way to go, but you've demonstrated it's doable, right? And so we have, in fact, Rick Pollock, the president of the American Hospital Association, 5,000 hospitals. We have Jim Madera as part of a collaborative, who's the president of AMA with all the physicians. We have Beverly Malone from the nursing community leadership. And of course, we have so many others all now ready to go and learn from you and work together to achieve this. Also, Healthcare Without Harm, which has already been working in this area. So thank you. That actually leads to this question for Don Berwick, because, you pointed out that you need to have a business case. You pointed out it takes investment. And now, hospitals in the midst of COVID saying, one more? Really? So Don is actually leading the group on metrics, policy, incentives to think about how we can make it easier and make it doable for systems to work together. So Don, over to you.
Thanks, Victor. I'm so excited by this meeting, by your leadership, and listening to the enthusiasm from Dr. Levine and Gina McCarthy Secretary Becerra and all of it. I mean, we've really got stacked the cards here for success. Victor, thank you so much for that and for inviting me to join. We don't have to talk about the urgency anymore. We know the urgency. We understand healthcare's significant footprint in this field. We can see the accelerating effects of climate change. And we know that in not just does healthcare affect climate, but climate affects health in ways that are just stunningly important, now declared by WHO the #1 health threat on the planet. So we're ready to go. But there's a problem, and I think we are not going to solve this unless we look at the obstacles with real clear eyes and honestly. As I see this is a kind of classic problem of the commons that Garrett Hardin wrote about. No one organization, not even one industry like healthcare, makes a massive difference that will be dispositive. The bystander role is available. People that argue it's not my problem, or I just would contribute a little bit. Even Greg Adams, if Kaiser did nothing, it's only a small loss. That's the nature of a commons problem. Any one agent can put their sheep on the commons and help destroy the commons. It's supposed to be an unsolvable problem. We also have the problem of competing priorities. Executives today in healthcare are worried about the pandemic. They're worried about workforce demoralization. They're worried about equity, of course. They're worried about money. And they're losing a lot of sleep, but not a lot of sleep about climate change in their organizations, I'd say, yet. And to adapt takes changes. Greg talked about what it took at KP to come together and kind of wake up and understand both the business case and the technical models. This also has another property, which is that it's not a fast emergency, which we're not bad at reacting to. When things go wrong, the child's caught in the mine, we get the child out. This is a slow emergency. It's accelerating, but it's still capable right now of being ignored by people that just don't realize the frog is getting boiled. So we have a real problem here. So that's where I think the work you've established here, the voice and leadership of the NAM and the real deeds that are now going to make a difference are absolutely needed. We know from the work of the Nobelist, Eleanor Ostrom, who I deeply admire, a Nobel Prize winner, the first woman to win the Nobel Prize in economics, who died unfortunately shortly after that. But she proved in her work, she won the Nobel Prize for proving that the problem of the commons is not inevitable. It's possible for communities to solve the problem when they all come together. And she's actually laid out the principles for doing that. Principles like understanding that there is a commons, defining the boundaries, coming up with metrics, tracking things, developing platforms for participatory decision-making, sanctions for people who are defectors from the group's decision to actually make a difference. So we kind of know what to do. Now, can the National Academy, with the collective you pulled together, Victor, do what's needed? Some of that is hard-edged stuff. We're going to have to look at the regulatory and policy environment. We may want to consider conditions of participation in Medicare, to name one that would be highly controversial. There will be financing issues, both the business case that Greg talked about, but also maybe linking this to the area of quality and value-based purchasing that we're getting into in healthcare. That would be a change, a hard change, a controversial change, but that hard-edged stuff we may need to deal with all together as a collective, saying it's time to get serious, as Gina said. There are certainly supportive steps we can take. I think clear metrics will be one of them. If we knew for every single facility in this country what its fossil fuel use is, what its carbon footprint is, we stand a chance of making progress. But if we don't measure, we're not going to make progress. I think the Academy has another wonderful role here, as does the collaborative, which is skill building. I think there are plenty of willing people out there who would like to know what to do, but they don't know what to do yet. And Victor, you and your colleagues, our colleagues, can arrange to build skills and knowledge just as you have in so many other fields, including my field, quality of care. The key here is to get started. The Academy can and has and will work with clarity, with force, with confidence, and bringing science to bear and trust, and getting people together to do something that only can be done together. Anybody can choose to be a bystander, but nobody should. And that's the case we're going to be making, Victor. Thanks for your leadership. I'm really looking forward to the next, to tackling this.
Well, thank you, Don. And I certainly feel that incentives matter. I mean, after all, in the profit world, there is this, this tax credit that you can get. What would we do in the nonprofit world? And this is where I believe that Rachel Levine, and of course, people like Andrew Whitty from United and others can think about what can we do to incentivize the hospitals who are facing challenging systems. I believe also giving them more grants for people to work on this issue, right? There's so many different tools that can be used. But I think one thing we've learned, of course, is that, the hospitals and the practices can't do this alone. A very big part of the health sector is the private sector, the biotechnology, the device, the pharma supply chain, which actually accounts for a big part of the emission of the sector. So we're so pleased that Michelle McMurry-Heath is with us, because I think what's unique about our collaborative is the fact we have her, we have many others, for all joining from the private sector, because they believe in this. They believe in ESG, corporate social responsibility. So I want to ask Michelle, how do you see this? Because after all, you have the most amazing biotechnology companies with you. Are they ready to join all of us to say, let's some goals together, let's measure things together, and let's really try to make a difference? Michelle.
Of course, more than ready. And I've got to say, what an amazing panel. Some days I think I could listen to Don Berwick all day long. But such an incredible conversation. And thank you, Dr. Dzau. I really appreciate you bringing this group together. And also for your commitment to think big and really make sure we make progress on the most consequential issues of our time, including climate change. So climate change is clearly out in front, and how we respond to our warming and changing planet will determine the fate of our society, and not just where we live or how we live, but the quality of our lives. So climate change is spurring rising temperatures and sea levels, but also greater threats to public health and from vector-borne diseases, for example. Those threats are particularly dangerous for individuals and families with the least ability to adapt on their own, and their plights, their fates must remain central to this work. So we won't make substantive progress unless we're willing to set lofty goals, and even as we take practical and purposeful steps to reach them. So bio members are doing just that. We were attracted to this issue for quite some time. Bio includes not just biopharma companies, but also agricultural and environment companies, some of which are producing some of the solutions that our healthcare sector will need to address this issue, and others who are just farther along this path. For example, our agriculture brethren have been tackling some of these issues for some time, and we have lots we can learn from them. So it's a thrill for me to lead a diverse and active organization like Bio. And it's a home to companies big and small working in all of these areas. And we really think there's a role for agriculture, nutrition, manufacturing, and healthcare. So like other members of the collaboratory, Bio's healthcare companies are committed to carbon reduction, with many of them making impactful reduction commitments and holding themselves to it. These companies are doing so to improve their environmental footprint, which generates a positive impact on people and on communities, and also helps them recruit talent, which, as we know in this day and age, is one of the most precious resources that a lot of our enterprises invest in. Biogen, one of our member companies, for example, last year launched their Healthy Climate, Healthy Lives initiative to eliminate its fossil fuel emissions by 2040 and advance action on interconnected issues of climate, health, and equity. The company's 2040 commitments include powering its facilities through renewable energy, establishing new green chemistry targets for all of the R&D that the company does, transitioning to electric vehicles, and eliminating fossil fuel derived plastics. And, people may think about straws or our plastic plates, but for a biopharma company, that also includes test tubes and plates and the containers that contain reagents. So there's so many ways in which our companies can really help contribute to the goals we're discussing today. But for all of our companies, biotech centers and investors, they're all committed to sustainability and addressing the climate crisis through science. We want to develop solutions that are shared and scalable to solve these challenges. And in essence, we're really kind of like the tip of the spear that we are discussing today. we can leverage our deep knowledge about the mechanics of life at the molecular level, we're biotech after all, to accelerate solutions that cure patients, protect our climate, and nourish humanity. And our members are using the latest technologies like CRISPR and synthetic biology to transition us all away from carbon. So let me give an example or two. So Join Bio is a joint venture between Bayer and the synthetic biology leader Ginkgo. And it uses biotechnology to reduce agricultural greenhouse gas emissions by designing nitrogen-fixing microbes, which reduce the need for critical synthetic fertilizers. Genomicata uses renewable feedstocks as well as engineered microbes and fermentation to make less carbon-intensive apparel, footwear, and plastics. And they do it all with fewer toxic ingredients. So these are just a few of the examples of the amazing science that can help us along this path. And Bio's really playing an important role supporting these companies through advocacy, collaboration, and education. And it's part of our job to connect these agricultural and environment innovation leaders with broader healthcare supply chains and delivery systems. So we want impactful ideas and products from one corner of our membership to strengthen and increase sustainability of our other members and members throughout healthcare. So to that end, this meeting and this broader effort are important reminders that the pandemic revealed the profound connection between all living things. And emerging zoonotic diseases like COVID-19 will become more prevalent as our climate changes and human populations migrate around the world. So mitigating climate change is one of the most crucial steps we can take to improve and protect public health. So thank you so much, Dr. Dzau. It's a pleasure for us to join you on this journey.
Well, thank you. Thank you so much. And, you know, as I think about this, your leadership really counts when you're looking at large and small companies. It's not only large ones, because if you start the small ones thinking that way and being committed, then of course they will actually do the right thing as they get larger and larger. And what we're hoping, of course, through this collaborator is to say, let's have the private sector, from bio to pharma to device supply chain, and all your membership together to say, we set goals together. And that, I think, is an effective way to get there. So thank you. I should say that we have the CEO of the Supply Chain Alliance. We have CEO of Medtronic and many others all joining this collaborative. So I think that we have all the pieces together. But one of the really important issues, of course, is communication and education, particularly in health professionals. And, you know, Renee, you're not only part of this working group, but you have been leading a lot of efforts in this area. Tell us a little bit about what you're doing.
Well, thank you, Dr. Dzau, for your phenomenal leadership. I am inspired and full of hope, and I know that will continue throughout this discussion and beyond. And it's really an honor and privilege to be here with all of you and my esteemed panelists. So, yeah, I'm going to reflect on the enormous opportunity to...
Can I interrupt for a second?
Yeah.
Congratulations. You are been selected as a member of NAM. We announced that today. Congratulations. Well deserved.
Thank you. No, I'm deeply humbled, and it'll be one of the greatest privileges of my career to work with you and the rest of the Academy on this effort. So, yeah, so I think to that point, I mean, there's an enormous opportunity to engage in the increasingly activated 22 million healthcare workers in the United States, or 14% of all US workers. I mean, this largely untapped legion exists in all corners of the country and are bonded, like all of us here today, in a common mission, and that's to improve health, prevent harm, and accelerate health equity. So I'm going to highlight 3 key opportunities. First, connecting to our mission. Second, connecting or creating a new toolbox. And third is catalyzing transformative, mission-driven change. So first, for too long, climate change has seemed peripheral to clinical practice and disconnected from the day-to-day lives of those in the medical community. And that's been a driving underlying issue for us in our work, because climate change is not distant or unrelated, and it's fundamental to our mission. It's contributing, as we've discussed right now, to individual level health harms, creating and worsening inequities, making clinical practice harder, disrupting healthcare delivery and threatening the delivery of high quality care. So there's two patient examples that exemplify this, and their primary diagnoses may differ, but both patients share a common secondary diagnosis that is often missed, and that's climate change. Because secondary diagnoses are just conditions that make it harder to treat or prevent the primary. The first was an elderly man with a heat stroke whose wife called 911 because he was acting confused during a record-breaking heat wave here in Boston. And he was found to have a core temperature of 106 degrees Fahrenheit. Now, a recent study found that more than a third of heat-related deaths in over 200 US cities were attributable to climate change. The second is a springtime asthma exacerbation in a 30-something-year-old female. This is a common thing we see. But climate change is responsible for about 50% of the observed trends of longer pollen seasons and 8% of higher pollen concentrations. So the diagnosis of climate change is there, even if we aren't always making it. Yet that this treatment of this diagnosis falls outside of our usual medical toolbox, which is why the second point is so important. And that's that health professionals across the spectrum, doctors to nurses to social workers, and across the practice spectrum, so from retired to practicing clinicians to trainees, we need a new toolbox to face this unprecedented challenge. And first and foremost, we have to communicate these connections because, as we've discussed, evidence shows that health professionals are among the most trusted messengers to disseminate this. And we have a unique and unprecedented ability to put that human face on climate change. But we also have to help clinicians adapt their practice easily and seamlessly, guided by evidence to identify their most vulnerable patients and intervene. Notifications, for example, could be in the electronic medical record and can highlight patients who are at higher risk due to their home address, occupation, medical conditions, or medications, and can prompt the screening and interventions. And we have to create pathways to train the next generation of leaders. This brings me to my third and last point, and that's the fundamental need for transformational change, which includes unprecedented collaboration and coordination among the legion of health professionals across the US and the globe. Because we've seen with the COVID-19 pandemic that the healthcare sector can rapidly mobilize and adapt if there is sufficient motivation and necessity. So we have to connect back to that mission with urgency, which we've already highlighted, with clear objectives and sufficient resources. And we have to rapidly accelerate implementation on a scale that we have never seen before, because every fraction of warming has implications for health in our healthcare systems, and our mission mandates that we cannot rest until health is fully protected. So this means we have to get to the root cause, as we've discussed. But we don't stop at a 9% reduction in systolic blood pressure for hypertension. Similarly, our goal has to be 100% reduction of greenhouse gas emissions, even beyond our own footprint. And US healthcare efforts to decarbonize could be the first domino to fall, serving as that catalyst that accelerates wider transformative action.
Right.
Using, for example, its economic influence to push those vital levers within the electricity sector and the supply chain system. So in conclusion, we are the sleeping giant and we are awakening. And the heart and soul of this medical community is and are the healthcare workers. And we are fundamentally woven together in this common mission and uniquely positioned to model the urgent, unprecedented, transformative action that's required, creating sweeping change not only within our own walls, but always keeping our eye on that true goal that our mission mandates. Because, and this was what drives my work, is that if we don't do it, who will? And we are on the cusp, emboldened by this effort convened here today, and we will achieve it together. Thank you.
Thank you. Now, do we have energy and commitment, or don't we have, right? It's amazing.
Victor, I'm going to start standing up and saying amen.
Exactly it. Yeah, so let me go to Howie, another newly elected NAM member. Congratulations, Howie. And you know, Howie, you've done so much in this space. And of course, I thought of you when I say, look, really important part is innovation, research, where do we need to go? But in your recent job in this Trust for Public Land, you really, which is not in the health sector, but the plan is to look at 3 core elements: health, equity, and climate action. So you have demonstrated how important it is to think about cross sectors. So Howard, tell us a little bit about what you're doing and help us think about where we need to go in our research.
Victor, thank you so much. What a full and inspiring day this has been. Thank you for your leadership and vision. And what an honor it is to join your President's Forum with this distinguished panel, especially, as you said, as a new member of the Academy. Thank you. Let me start by addressing research and innovation, building on the many excellent points made by speakers during the course of today. And in the case of research, building on a bookshelf full of research agendas published on climate and health. I'd argue that we need purpose-driven research, research designed to deliver the knowledge we need to enable us to do what we need to do as a civilization, a nation, and a health profession to succeed at what can only be described as a rescue mission. So what do we need to do? I'm guessing all of our to-do lists would look pretty similar. And what do we need to know in order to do it? I'd propose 6 categories of need to do and 6 categories of need to know. First, we need to anticipate and understand health threats. The research question: how does climate change threaten health and who is most vulnerable? How is the nutritional value of foods changing? How are vector-borne diseases spreading? How is young people's mental health being affected? This is the diagnosis. Second, we need to adapt to unavoidable health threats. The research question: what protective strategies and practices work, especially for the most vulnerable? How much does tree canopy help cool urban heat islands? A question I'm helping to address at Trust for Public Land. How to cope with episodes of wildfire smoke? How can relocation from coastal areas best and most equitably protect affected people and communities? Third, we need to decarbonize our entire economy: energy, transportation, agriculture, buildings, and more. The research question: what are the healthiest ways to decarbonize? How to design and build deep green buildings that deliver plenty of light, clean air, opportunities for physical activity, and other human needs. How to assure that wind turbines and biofuels don't inadvertently harm people's health. Fourth, we need to drive ambitious mitigation targets, especially with Glasgow approaching. The research question: what are the health benefits and associated cost savings of decarbonizing? This is research at the interface of health and economics. How much money do we save by closing coal-fired power plants, by increasing walking, cycling, and transit use? That leads to the fifth. We need to influence public and policymaker opinion, especially with key legislation now hanging in the balance. The research questions: what are the most effective communication strategies? What are the political and social barriers to change and how best to overcome them? This is social science and policy research blended with biomedical research, perhaps the most pressing questions of all, given the urgency of the climate crisis. How do we frame climate action in ways that persuade skeptics? How do we effectively combat disinformation, a topic throughout the course of today? How do we counter the undue influence of the fossil fuel industry? Sixth, we need to clean up our own house, as many have pointed out. The research question: how do we decarbonize healthcare in safe, efficacious, cost-effective, and climate-resilient fashion? This includes developing new materials and manufacturing processes and testing low-carbon practices such as telemedicine. It also includes prevention research, since less demand on the healthcare system from fewer sick people reduces its carbon footprint. And health services research to eliminate needless treatment, administrative waste, and other avoidable contributors to our carbon footprint. Finally, as for innovation, we need to support innovative methods development, interoperable health and environmental data systems, modeling and forecasting techniques with big data analytics and AI, health impact assessment techniques. Much of this, by the way, aligns very closely with the needs identified by NAM's COVID-19 working group in the context of that crisis. We need greatly enhanced training and career pathways. Careers in climate and health research need to be as well supported and sustainable as careers in oncology or cardiology research. Because so much of this research links health with other domains, such as energy, agriculture, and urban planning, we need innovative funding mechanisms that cross silos. We need NIH and NSF to team more effectively. We need NIH to co-sponsor research with such federal departments as agriculture and transportation. And we need private funders to fuse their health and environmental funding. Finally, we need bold institutional innovation. One example, as Marshall Shepard said earlier, we need promotion and tenure criteria that reward active engagement outside the ivory tower. Another example, I and others have suggested an NIH National Institute of Climate Change and Health. If you don't like that idea, what are other ways to combine a clear sense of mission, expertise, creativity, and nimbleness in the institutions that drive research on climate change and health? So all for effective research that tells us what we need to know, all for innovation to get us there, and all for the full core press that every speaker has endorsed. Thank you, Victor.
Thank you. As you know, there are now more and more foundations interested in funding research in the intersection of climate change and human health. Earth Welcome Fund, one of our partners, is foundational sponsors, is certainly working that. And we're going to bring more foundations into this space. At the same time, I believe there's an opportunity for NSF and NIH to step up. And I'm sure there's lots of opportunity there as well. So thank you. So maybe I can go back to Dr. Levine and ask this question. Is the Biden administration, as you heard from Gina McCarthy and yourself, it's all of government, all of societal approach. Bring all the pieces together to make it work. Now, as you heard, it's a complex puzzle of all the pieces have to fit together. So NSE goes to COP26 to say, let's commit US to these goals, which I think we all support. How do you see advancing this? And how in particular can we work with you to advance some of those, I would say, pretty complicated issues?
Well, thank you, Victor, for that question. So as has been noted, the Biden administration is firmly leading the call to action on climate change. And in regards to climate change and health, HHS is really the model of interagency collaboration. So CDC and NIH have been leading partnerships with other agencies such as NOAA and NASA and working through the U.S. Global Change Research Program. What we're hoping for is this new office of climate change and health equity will really be the tip of the spear, that we will have a focus within HHS and sort of bring it all together with the all of HHS approach to focus on climate change. You know, HHS is a big organization. It's far reaching. And so we need within our house to align all of our divisions to work in a collaborative, integrated fashion on climate resilience and mitigation and addressing the health effects of climate change. And so we are, the office is small but mighty. It's only started in the last month, but we're already actively participating with federal interagency groups to provide that structure to expand the collaborations on those climate change and health issues. I had mentioned, but we really also want to partner with our regional offices. Our regional offices work really closely with other federal agencies, but they also work with the state and the local health departments and other stakeholders in those regions, where we have to extend our whole government approach, to states and to cities as well. It's not enough for the federal government just to act. We really need to have collaboration with state and local health departments and state and local governments as well. In addition, my office, OASH, is home to the Interagency Working Group to decrease risk of climate change to children, the elderly, people with disabilities, and the vulnerable, as well as the biannual Healthcare Readiness Advisory Council. So, we're going to be working across the agency and across the administration. And again, we have to have that very important health equity lens, because we know that the challenges of health equity and the depth of health disparities that are in our country. COVID-19 has shown us that like nothing else. And so it's going to be the same with climate change. Those same communities are going to bear the brunt of climate-induced risks. We've talked about extreme heat, poor air quality, flooding, weather events, vector-borne diseases. And so we have to ensure that health equity is front and center as we all work to reduce our carbon footprint.
Thank you. Thank you very much. That sounds like a great plan. And certainly we're there to work alongside with you and to make it work from our point of view. This question is to Greg, Don, and Michelle, because I think we all agree that we need to measure. And of course, a famous person said, you can't improve what you don't measure. So the question of measurement comes up all the time. And, we need standards. What do we measure? And to Greg, you measure in your system. What do we need to measure across all hospital systems? And to Michelle, what do you measure across the industry? And what are the needs for standardization? Is there actually people coming together to say, let's measure this, and we agree what to measure? And to Don, the whole idea of scope 1, scope 2, scope 3, and you've done so much in the past of measuring. I keep thinking about quality. Like, I used to be a hospital CEO. And of course, every single board meeting, every single management meeting, we look at how we're doing quality and safety. How do we get there to measure these things whereby we can say, let's be transparent, and then we can be accountable? So anyone want to start first?
I'll offer a couple of thoughts. One, it was very important for us to have the vision and the goal and to be able to articulate that to the organization. Two, I talked about the work we did around a business plan and being clear that we could get a return, and we connected it to health. And then as I would say, everyone or a large part of our organization was energized by this work. And we connected it to health, we connected it to issues of inequity. So people not only understood and understand the urgency, but they also understand how it really connects to what we're doing every day. But we measure by facility. Where are we with kilowatts per square feet? Where are we with kind of BTUs per square feet for gas? So I think having those metrics and being able to hold the organization accountable is important. The other thing is the plan. Having a plan and being deliberate about how we're going to exercise and operationalize that plan. We're actually, in the process of working through, when and what should we set as a target for when we'll be net zero neutral and working it. People are owning it. Came to me 2 weeks ago. But when we looked at where we are and how we're preparing, the plan isn't solid enough. And so, we have to be deliberate. We have to be focused. Now, when I think about healthcare as a whole, if you look at what we did and Don and our colleagues, the issue is, can we begin to look at the healthcare industry, create the goal, begin to identify the steps in the plan, and begin to identify what are we going to measure by hospital, by pharmacy organization. There are many sectors of healthcare. So I think having kind of this comprehensive coordinated plan, as somebody mentioned, for all of healthcare is important, and I think it can be done. And I think people are at a place where I think people are ready to own this and people are ready to lead. I think COVID taught us what we can do, and I don't think we should lose that moment.
Thank you. Michelle?
Certainly, happy to jump in. This is an area where I think we have no shortage of measurements. The question is just, can we agree on which measurements are meaningful? And that's where the question of standards becomes very important. We're all clear, when Greg was talking about being climate sensitive as making good business sense, that is wonderful when you have very motivated leadership, but even for leadership that's less motivated, having clear metrics that lets organizations capture the value of investing in preventing climate change is critically important. So people want to know exactly how much greenhouse gases they have prevented. They want to know that using biofuels has had an impact. They want to know that their actions result in something that they can measure, be held accountable for, and also get credit for when they've done a good job. And that's where I think the Action Collaboratory can be incredibly important to make sure we're all working from the same playbook.
Yeah, I quite agree with you. I think in one of our planning meetings, we heard very clearly from many of your colleagues, we're ready. If you can bring us together to standardize what we measure, I think that we'll be all ready to support this. I think that's really very exciting. So Dawn, I mean, you know, you've gone through this before many times. How do you think we can move this forward? I mean, it certainly is the hope of the collaborative that we will come up with measurements and, you know, it should be co-designed, you know, agreed upon what we can measure and be meaningful what we measure. But, you know, nobody likes a proscriptive top-down to say, thou shalt do this. But still, we need to measure what matters. So, Don, what do you think?
Yeah, of course. The context right now is we realize we've overshot on measurement in healthcare. There are too many metrics out there. So there's a very important part of the quality movement now is to get the metrics more under control. So we're kind of swimming upstream, but we need them. We have to have them. My guidelines would be three things. Simple, outcome-oriented, that is what we care about, and now. So I will hope in the great work I'm going to get to do with Liz Fowler. Liz Fowler is my co-chair of the Policy, Finance, and Metric subcommittee you set up, and I'm thrilled to work with Liz. I think CMMI might actually have something to contribute here. But yeah, simple, few, now, and outcome-oriented. The outcomes I think we ought to be looking at are carbon and fuel and fossil fuels. I think that fossil fuel use, and I think I will certainly we should rely on the wonderful work that many have done, Healthcare Without Harm and others, to develop a candidate set. But I'm going to be a little obnoxious pushing our collaborative to settle on some now. If we get them wrong at the start, we'll change them later. But without measures, we're not going to make a ton of progress. On the quality front, if I can say one more thing, absolutely, there is a real strong nexus between this endeavor and my part's work for the 4 decades improving quality. Jody Sherman, who's one of the people you recruited into this effort, has made these points very eloquently. The opposite of quality is waste. That's what we teach in my field. When you're doing what matters to people, that's quality. When you're doing what doesn't matter and doesn't help, that's waste. And so the whole quality movement needs to be oriented around not doing things that don't help. Waste of equipment, supplies, ideas, procedures. And we know the research shows there's a tremendous amount of waste in healthcare. So these align really, really well. And if we focus on the relationship between the improvement of quality and the reduction of the carbon footprint, we're going to find lots of possibilities here. So I find that pretty exciting. And I believe that what Greg has said, and which we're going to have to work hard to make the case for in the industry, that actually given that linkage, when you work on improvement and you get decarbonization and cost reduction at the same time. I think that may be true, and if we can prove it, it'll really help.
Yeah, we got to do that study, isn't it, right? Look at the business case, the economics. I think it's there. Nobody's quite done it yet, but it's like the issue in quality as well, or the burnout. And you look at how much economic loss from people turning over and quitting the workforce. That's another business case. So there's so much that we can be doing. But you know,
Doug, I would invite you to look at our numbers. I actually reviewed them, and our CFO wouldn't let me use them yet. But look at the process, look at the numbers, because I do believe that it's real, and I expect those savings to increase over time. So I think there may be a methodology that we can share as we kind of take this on.
Well, this is one of the goals of our Grand Challenge Collaborative, is to really do the study as well, so that people know there's a real case there to be made. And as Don said, the tools of how to do this, right? Everybody's saying, okay, I'm ready to do it. So what do I need to do? But Greg, you raised another issue. You had a full-time I think you called it, I couldn't remember what you called it, but I suppose a sustainability officer. I mean, do we need to actually elevate this position, just like in quality, in hospitals and the systems, whereby it's a focus on the individual to deliver the results at the highest level? I think this question is for everyone, I suppose.
I would say we do. I think the issue, if we truly believe the issue, and we do, I mean, we've heard everyone say that, this is a healthcare issue. It's actually a primary issue in addition to being secondary. I mean, when you see an entire city burned to the ground, a hospital evacuated, and then you have the emergency rooms and people needing and seeking care as a result of all the respiratory issues. It is, and you bring that together with equity and the issues that we've got with disparities. I think we bring all of these together, and you look at COVID and how we got there, and it points to really a crisis. And I think, if, again, I said earlier, if you look at what we've been able to do with COVID, I mean, it's a symptom. And what we're really talking about is how do we get to the systemic, the groundwater issues? And the only way we will get there is that the resources and the focus and the research and the data has got to be there, and people have got to own this, and they can't own it as, on the side of their desk. They've got to own it, and we've got to elevate it to a level of importance that aligns with the mission that I started with, because we are not contributing to the health of our communities. We're not living into, really maximizing the health of individuals unless we bring this together and own it and put the resources behind it.
Yeah.
It's going to mean it's got to be in the boardrooms and the executive suites.
That's exactly right.
Exactly, right. So Howie, I mean, we just talked about research, right? Research that's going to make a difference, right? Research that is going to drive changes. So I'm thinking what you said earlier about, the funding, the financing, et cetera. How do you bring together researchers from both the climate sector and the health sector together to say, yes, we need to collaborate, we need to bring convergence, we need to bring different sciences together to really drive the change, and then being able to measure the impact and being able to take research into application? You're muted.
You would think that by this point in the pandemic, we all would have learned to turn off our mute buttons. Well, I guess I'd start early in the pipeline. Several people have mentioned, Renee and others, that we need to think about how we train people. If I could tell a story, when I was getting ready to go to medical school back just before the First World War, the courses I had to take were biology, chemistry, physics, and math. My daughter, when she was getting ready to look at medical school, had to take the exact same courses. And she said to me, Dad, does it make any sense that that hasn't changed in a generation? Shouldn't we all have to be taking ecology, evolutionary biology, behavioral science? Aren't those things as important to understand health and context as the basic sciences? Well, there's some truth to that. So thinking about interprofessional education on a broad scale, training our health professionals, both practitioners and researchers, to be, if not fluent, at least conversant in urban planning, in parks and green space, in transportation, in energy and ecology. This is really the new reality for medicine. So it's a transformation in the way entering and rising professionals think. Then we need leadership. And so I think that we need mentorship and career pathways with funding, but also with models of the kinds of synthetic research that you asked about, so that young people can be as inspired by that kind of research as they are by existing mentors now. And we need post-siloed funding. That means funding that doesn't stay categorical, but actually attempts to answer cross-cutting questions. So let me call out Robert Wood Johnson Foundation, Rich Besser, for funding investments, both in research and in application, of how changes in community structure can both tackle the climate crisis and advance health. I'd call out Kaiser. So Greg, congratulations. These are community benefit investments that actually look to the environment around hospitals to create healthier communities through physical infrastructure, something that probably ought to be much more common and would inspire health professionals to think in the synthetic way that we need.
Yeah.
So I think from the beginning of the pipeline to the pathways available for career building to the funding available to support this research, there's a set of answers.
Perfect segue to Renee. She has that ambition. Now, Renee, tell me whether you're getting traction from the program directors, from the deans, from, and this is all interprofessional training as well. So how are you going to try to move forward this issue? Now, I would say the good news, as you know, is in our collaborative, we do have AAMC and many other educational organizations part of this. But talk to me about how do you imagine us doing this an effective job?
Yeah, well, I was reflecting on the concept of measurement, and I think it's something that has really resonated with me because we think about vital signs, right? The things in a chart that are prominently displayed. And as we gain increasing recognition of how climate change and air pollution and environmental racism and how these things impact the health of our patients, we have to elevate them. And a key way to do that is education. So the collaborative is enormously well placed to be able to act on these key levers of action in order to educate and activate this enormous legion of health professionals around the US and the globe. Now, so many educators sort of get a little nervous when they think about they have to add an entire new area to their already packed healthcare curriculum and medical curriculum. But I challenge people that we're adding a climate lens to what people are already learning. And all that means is trying to view whatever it is that's being taught through how climate change is impacting that issue now and how it's going to increasingly impact that in the future. So that can just mean one or two problem-based learning questions or one or two extra slides. So as people begin from the ground level to understand the importance, and I'm seeing that now across the country where there are grassroots education campaigns within hospitals and training programs, but the collaborative has the enormous ability to really mainstream that. And as we connect this to the mission, right, one of the resounding themes through this conversation is that this is at the heart of our mission. And as we educate people on that, that's how we are going to accelerate to a tipping point and we will achieve everything we've set out to.
That's a bold vision, and we're all championing for success. Let me speak to the audience. We're going to open up for general questions. So when you begin to think about what you want to ask, please start writing it down. We're going to use the chat function, so if you can put in your questions to the chat box, we'll be able to pick up those questions and ask the panelists to address some of the issues they want to bring up. As I hear this, I just think that, look, why us? How will we succeed? And I do come back to the sense that I said earlier. Number one, I think it was Ed Maybach who said earlier, we're the trusted profession. We should take this on. Despite all the misinformation, et cetera, I think doctors, nurses, and health professionals still most trusted. So we should take this on to educate the public, to communicate, and to call it as it is, a public health crisis, an equity crisis. So that's really important. Second thing is we're doing this, we need to think about how to change systems, and Howard already talked about how many interactions, also Michelle did too, and Rachel, interacting systems that we need to bring together. And I should point out that at the National Academies, it's not only NAM, we're working with our brothers in engineering and other sciences to see how we can collectively work on this together. We need to look at how to decarbonize and make the health system more resilient. I think if you look at representation in this room, you can see that we're all ready to say, what do we need to measure? And how do we actually measure this? How do we hold ourselves accountable? And how do we begin to set goals? Doing what Greg and others have done successfully. And of course, that's where Don Berwick talked about the need for incentive policy. And finally, of course, research and innovation. So that's our grand challenge. And I think people know this, and we got the best people to work together. It's not going to be a quick fix. It's going to be co-design, collective solutions, collective action over time. But you heard Greg, it took him a long time to get to net zero and carbon neutral. Well, hopefully that we can mobilize the entire sector to move towards the same direction in a timely fashion. So with that background, let me find out about questions from the audience. My staff has been monitoring the chat. So let me turn to my staff and see whether there are any questions coming from the general audience.
The first question that we have is the following. Will reforming regulatory policies be in scope to facilitate change? Many health leaders point to regulatory barriers to reform. For example, they cannot make changes to their products or processes since regulators require single-use products.
Yeah, this is a question, Michelle, particularly your sector has brought up, right? We're ready to make changes and innovation and doing new product, new packaging. But the regulatory, shall we say, hurdle is high, and it's also very costly. Is there any way to incentivize this? I wonder if, Rachel, if you can think about, in HHS, obviously FDA and many other agencies are involved with this. Any thoughts on this?
So yes, I think that we will need regulatory change, and I think that we'll need legislative changes as well in order to maximize our success. So this has to be a public-private partnership. Each aspect can't do it alone, and at HHS and other departments as well, we'll need to look at a lot of our regulations that are contributing to the problem, and be able to pull those levers to be able to incentivize decarbonizing not only the healthcare sector but other aspects of our economy, and then to incentivize that decarbonization. So yes, I think that we're going to have a really close look, and that includes, as you were mentioning, CMS regulations. That would include FDA regulations, really across our department and across the administration.
Thank you. Michelle, can you share with us some of your experience in this? What are your members saying?
Well, I think it's so amazing to have Dr. Levine make that commitment because it's really, really important. One of the things that's going to be critical is that we not just look at this as a U.S. focused issue, but that we also use the U.S. leadership to drive global regulatory harmonization. I was responsible for a team that had to get medical products into 150 markets, and sometimes navigating your way through all of those regulatory systems could take 5 to 7 years. So you imagine a change in manufacturing that then needs you to reapply for FDA approval or the analogous approval in other countries. And you're talking about incredible time and expense, and most importantly, patients waiting on those innovations. And so this is an amazing opportunity for the U.S. to step up and lead and push for a harmonized approach to a pragmatic solution.
Thank you. Another question.
Next question. How can health systems and hospitals support its workforce to develop deep and organization-changing climate resilience and expertise? How can this start even earlier in health professional education and training?
Seems to me I should direct this question to Renee and also to Greg. Renee, you want to take this on?
Happy to. Yeah, I think first and foremost, engaging people within the institution, bringing them to the table, bringing communities to the table. It is so important for bring everyone in at the ground level. And so as we think about this transformational change, it's the grassroots cannot be stressed enough, at least from my perspective. And so being able to harness these individuals in order to motivate them and empower them to help develop that collective path forward. I mean, they can then go off and exponentially help to further incorporate education into earlier into training programs and sort of beyond. So it's this activation army, so to speak, that is being created. And I think that is essential within institutions in order to, given the scope and the unprecedented nature that our response has to meet.
Greg, what do you think?
I think well said. I would add to that, part of what we want to do is to connect the dots for people and connect the dots for our employees and connect the dots for our communities. So as we're on a journey of looking at our quality outcomes through the lens of ethnicity and race. We're on a journey to look at how do we bring into kind of the care planning for our patients and our members, the social needs that they have and understand how they're impacting their health. And I think, this issue of climate change and what it is doing environmentally, I think we've got to connect that to what we do. I mean, I've mentioned it in terms of our mission, but it is about, you can't bring health to an individual or a community without owning this. And so connecting the dots, helping people understand it in terms of it being a core part of how we're going to deliver care and how we're going to advocate going forward. So, I think Renee, and then the education, but I do think there is something about all of these things going on. They're all big, they're all connected. And so our beginning to frame this in a way that people see, understand, and really get that it is core to what we do.
Well, it's an important segue to talk about the equity issue that Rachel, she's created this office for climate and health equity, and she's talked about their plan of how to reach the community. But I think we all are part of a community, right? As been pointed out. And so how do we all work together? Rachel, help us think about how you would like us to work along with you. I mean, each one of us have a community, whether it is in the clinical care arena or whether it's in the research arena, et cetera. But more importantly, I think each one of us should also recognize the importance of working with marginalized communities. How can this collaborative be helpful to you?
Well, the collaborative is absolutely critically important because, as I mentioned, government's not going to be able to just do this. This is going to have to take an extensive public-private partnership with the healthcare sector, with hospitals, with health systems, with biotech companies, with education, as you were all mentioning. It's really going to take us all working together for us to be successful. But I have to emphasize, I think health equity has to cross-cut everything that we do. And so we're really trying to do that. It's really a priority of the Secretary, priority for my office as well, is that we want to look at every division at Health and Human Services with that health equity lens. So that would include, everything at CMS, looking at health equity, everything at FDA, at NIH, they have a whole initiative in terms of health equity. And so for this initiative, there are populations that are already being far more impacted by climate change than others. So take the heat emergencies that we saw in the Southwest. We had heat emergencies in the Northwest. It was 105 degrees in Seattle. Well, if you are fortunate enough to have a great air conditioner in your home and in your apartment, then you're going to be much less impacted than if you're just trying to open the window. And that's just a simple one. If you are in New Orleans and Hurricane Ida hits, not everybody has the opportunity and the resources to be able to evacuate. And they can't evacuate. They might have to stay. And we saw certainly with Katrina and also somewhat with Ida how different communities were more impacted than others. So we have to bring this health equity lens. And I think that your collaborative through the National Academy of Medicine is the perfect vehicle with which to initiate that and to carry that forward.
So our plan is to actually have a equity working group, and we plan to bring in lived experience. So not only have we done a lot of work in this area, the National Academy of Medicine, in equity, addressing structural racism, but we want to bring in lived experience. So you have a voice and tell us about what we need to do in order to address some of the big disproportionate issues in the community. So thank you really very much. Howard, any thoughts on this area or any related areas?
Well, on the education issue, Victor, I was just going to mention for those interested that there is a great compendium of educational materials at the Global Consortium on Climate and Health Education at Columbia's Mailman School of Public Health. So those who would like to initiate educational efforts can find lots of resources there if they'd like them.
Yeah.
But also mention the importance of encouraging activism and aspirational thinking in our young people. In so many institutions, it's students who push for the courses and the training in this area. We need to encourage that student energy. It's a powerful resource.
Yeah, you know, it's been pointed out to us many times through our planning, and particularly from Phil Pizzo, one of the co-chairs of the Grand Challenge, that intergeneration communication education is really important, right? And mobilize the younger people. So that's also on our radar screen as well. Let's take another question from the audience.
Next question. We've heard about the critical need for quality metrics. Could you speak further to the gaps in current metrics and how the Action Collaborative is addressing this? Further, Renee, could you perhaps speak further on the metrics agreed upon by the Lancet Countdown Project?
Okay, so let's start with Don first. Don, you're the most experienced person, the king of metrics. Think about, how do you want to answer this question?
I won't agree to the title, but you know, in our 100,000 Lives campaign, which was mobilized 3,100 hospitals work on patient safety in 2004, our motto was "Some is not a number, soon is not a time," and I think we might want to import that model here. We've got to get going. Time is wasting, and some is not a number. It helps everyone to say, "Let's take that hill." You have to name the hill. It's not a control move. It's not a matter of beating up on people. It's just deciding what you're going to do, and that will take the form in this collaborative of, I think, as I said earlier, specific metrics of carbon reduction and specific metrics of fossil fuel use at a minimum. I defer to other experts. A small number. It's inspiring to do that. And so I think we should treat it as an asset, not as a battering ram. I also want to emphasize really strongly that if we only use metrics, if we only use battering rams or incentives, we will miss the point. We'll miss 2 points. Point number one is we'll miss the importance of supporting the industries through knowledge. Like, what do we do? Okay, I'm with you now. Tell me what to do. And I really look forward to that part of this project. Yeah. The other is back to what Howie said. I think we're going to strike oil if we do this right. I think the hard part will be in the boardrooms and the executive suites. But I think the workforce wants to do this, especially the young workforce. We've heard in your other work you're doing, Victor, about the importance of the demoralization of the workforce right now, this crisis of confidence and buoyancy. I think out there are millions of healthcare workers who want to help save the planet. I think a lot of them are youth, and we need them. And I think what Howie said is absolutely dead center. If we treat it as just holding their feet to the fire or metrics as a incentive, we're missing the point. This is metrics as release, a way to say, hey, everybody, let's take that hill. And then we measure taking the hill. I think it's a pretty exciting possibility.
I think that's what Michelle's hearing from her workforce as well. I think there's so many young people entering the workforce in private sector who also want to look at mission of their business and how they're doing public good. Yeah, so I know that for sure. So Renee, you want a quick answer to that question?
Yeah, well, it's a wonderful plug. Mark your calendars. The 2021 Lancet Countdown Report is being released Wednesday at 6:30 p.m. Eastern Standard Time. And the Lancet Countdown is an international research collaboration that tracks how climate change is harming health across the globe and how to put health central to our response and how mitigation can have health co-benefits and how we need to frame our adaptation and resiliency, but it also looks at economic and policy and public engagement. So it's across that spectrum. And as has been brought up, I mean, right now, these indicators are really targeted globally at what can be measured, because any indicator has to be able to represent the globe itself. And as we know, there are data limitations in certain aspects of the world. Yeah. But there's an enormous potential here in the US to create nationally tailored ones that act at these very levers that we're talking about.
Well, I had just a fabulous time talking to all of you. Let me end with a lightning round. Ask you each one to just say, name the 1 or 2 priorities you'd like to see the collaborative, the grand challenge accomplish, and how can, in fact, all of us work towards those. So let me begin with you, Renee. So you're still on the Zoom in my radar screen.
I reiterate that there is a coalition of the willing that is present right now that just needs a way to engage. So activating this army of individuals across the United States that want to act because it is aligned with our mission. And that includes communicating optimally and ensuring that we are educating in a way that accelerates us towards the change we need.
Thank you. Greg? You are muted.
Sorry, Howard, I didn't learn. I think Don's comment about climbing the hill and how do we measure climbing the hill is really important. I think the second thing I would say is really kind of owning this and the connecting the dots in terms of equity, healthcare outcomes, and our trusted voice being out there in a very visible and precise way. So communication and measurements.
Thank you. Howie?
I want to close by talking about hope and despair. It's all too easy to succumb to despair when you think about climate change, and too many of our young people are doing that. But we need to be about propelling hope. First, because hope is good for health. So if we care about health, we have to care about hope. Hopeful people are healthier, hopeless people are less healthy. Second, because hopeful people take action, and we need action at a time like this. And finally, because there's a lot of empirical basis for hope. There's no evidence that we've lost this fight. And there is a lot of good news out there. Photovoltaic energy cheaper than ever. Batteries more advanced than ever. Young people more active than ever. And Victor, leadership of people like you and the people you've pulled together is inspiring a lot of great work. I'm hopeful, I'm energized, and I think we should all work to feel that way and propel it in others.
Thank you, Howie. And Don?
I think for me, it would be unity. I think we should create, as Liz Fowler said in the meeting, a sense of inevitability and change the sense of what's inside of what's outside the momentum of the industry. You have enough people in this coalition that if we really are able to come together with a single voice, it will be uncomfortable to be outside. And changing that dynamic to me will be core to success.
Thank you. And Rachel?
Well, thank you. I think it is the ability of this collaborative to catalyze this change and to pull together this public-private partnership and bring the two sectors together to look at not only long-term solutions, but actually short-term actionable opportunities that we have for success that will then mobilize for the future.
Thank you. So I want to thank the forum participants for really an energizing, inspiring conversation. If you think about this afternoon, starting with Gina McCarthy, where she was so energized, I think at one point she pounded the table to say, we got to get going. Has been said by all of you, the time is now. So we're not waiting. This collaborative, this grand challenge, and this collaborative has brought together already lots of people. We have to limit partnership and membership, but 50, 60 leaders all saying we're going to work together. As Renee said, it's a coalition of the willing. But you know what? There's a lot of people willing. They just want to know how. And in fact, as been said, the collaborative will be to together design, together think about solutions, together to act. So I am optimistic, like Howie. I do have hope, and this is why we're doing this. We do not see NAM as the solution. We see everybody working together as a solution. And we're just happy to be a catalyst and convener. I do want to thank the members who really, many of them, really came to me to say, listen, you're not doing enough. And I appreciate that they actually point the direction that we need to do a lot more in climate. And we are, and we will be. So thank you very much. And I want to thank all of you for tuning in today's program. And let's give a round of applause to our speakers. So the meeting recording will be posted online in coming weeks for those who want to revisit these important discussions. Otherwise, we've had a long day, and thank you, all of you, for being with us for the whole meeting. And thank you.